Imagine a disease so rare that it might affect just 1 in a million people. Beyond the textbooks, dive deeper than medical journals. This documentary unveils the real-life challenges and inspiring stories behind CARNEY Complex. This isn't the plot of a science fiction movie, it's the reality for those diagnosed with CARNEY Complex, a mysterious and complex genetic disorder that intertwines the paths of heart disorders, spotty skin pigmentation, and endocrine overactivity. Even the world's best doctors and scientists are continuously unraveling new layers of this condition, making every discovery as critical as it is fascinating. While many have never heard of CARNEY Complex, understanding it is not just important for those directly affected. It offers valuable insights into how genetic variations can impact multiple organ systems, knowledge that could potentially benefit the broader field of genetic research and medicine. What is CARNEY Complex? CARNEY Complex is a multi-system genetic disorder characterized by an increased risk of developing multiple tumor types, particularly in the heart and endocrine tissues. This rare condition is inherited in an autosomal dominant manner, meaning that the presence of just one mutated gene from either parent can lead to the disease. The genetic basis of CARNEY Complex involves mutations primarily in the PRCAR1A gene and less frequently in other related genes. These mutations lead to various clinical manifestations, heightening the mystery and complexity of managing the disease. Understanding CARNEY Complex requires a deep dive into genetics and the pivotal roles that hormones and heart rhythms play in our body, creating a fascinating yet challenging puzzle for medical scientists. Diagnosis and key signs. Diagnosing CARNEY Complex involves a combination of clinical evaluation and genetic testing. The key to pinpointing this rare condition lies in recognizing its unusual symptoms and patterns. The primary symptoms include cardiac myxomas, which are benign heart tumors that can, however, lead to severe complications like stroke or heart block if left unchecked. Secondary signs of CARNEY Complex are pigmented lesions of the skin and mucosa, often presenting as spotty, uneven skin colorations known as lentigines. These external markings can be the first visible clue to the underlying genetic disorder, sparking further medical investigation. Apart from the visual and physical manifestations, patients may also experience overactivity of the adrenal glands, leading to a spectrum of additional systemic signs that complicate both diagnosis and management. CARNEY Complex is exceptionally rare, with an estimated incidence of about 1 in a million people worldwide. This rarity makes widespread awareness and knowledge of the condition somewhat limited. The disorder affects males and females equally, and symptoms typically begin to appear in late childhood or early adolescence, although they can manifest at any age. This equal opportunity condition has been reported across different ethnicities and regions, although comprehensive epidemiological data is sparse due to the rare nature of the disease. The demographics of CARNEY Complex paint a picture of a condition that is ubiquitous yet elusive, challenging the medical community to connect across borders to pool knowledge and resources. There is no cure for CARNEY Complex, but management strategies focus on treating symptoms and preventing complications. Regular monitoring and early detection of tumors, particularly cardiac myxomas, are crucial. Surgical removal of tumors, when possible, often represents the primary treatment approach. In terms of prognosis, the outlook for patients with CARNEY Complex can vary widely, depending on the types and numbers of tumors present, as well as their locations and response to treatment. With careful management and regular medical checkups, many individuals with CARNEY Complex lead full, productive lives. This exploration into the CARNEY Complex not only lifts the veil on a particularly enigmatic condition, but also serves to remind us of the intricacies of human genetics. It's a compelling testament to the power of medical science and the enduring spirit of those who live with rare diseases every day. Discovering more about such rare conditions helps pave the way for better treatments and a deeper understanding of numerous other diseases, benefiting not just the few affected by CARNEY Complex, but potentially millions suffering from other genetic disorders. Like, share, comment, and subscribe.